Meet Greg, a 45-year-old male who's come in for a HDL test. Lately, Greg has been feeling short of breath and getting really tired. He fears it might be due to his increased weight. Greg is a smoker and works a relatively sedentary job as a truck driver. G'day, Greg.
Hi, Doc. How
are you going today?
Good, mate. Yourself?
Please take a seat.
Oh, cheers, mate.
So, Greg, I've got your notes here from the previous doctor. Could you just confirm your symptoms for me?
Oh, yeah, Doc, man. I just had a bit of chest pain, you know.
All right.
And,
Yep.
shortness of breath when I'm doing some work. And
Okay.
I've been playing all tired all the time, you know. I don't know what's wrong with me.
All right. Okay. Well, I'm sure we can help you out with that today. Dr. James here has referred you for a HDL count.
Oh, good old Jamie. I know him.
Yeah. Well, I'm not sure if you know, but do you know what a HDL count tests for and what it is?
I have no idea, Doc. You're the doc.
Well, disorders of lipids is of immense importance in the medical field today, owing to its strong relations to arteriosclerosis, obesity, hypertension, diabetes, and other complications. It is a lifestyle indicator of good health and well-being. So, how can an HDL count assist in Greg's diagnosis, and what is it? The two main lipoproteins we'll be focusing on for today's discussion are low-density lipoprotein, LDL, and high-density lipoprotein, HDL. Each with its specific function. LDL is responsible for carrying fat-enriched cholesterol away from the liver to the arteries, potentially blocking the lumen and causing arteriosclerosis. Contrarily, HDL is responsible for picking up the excess cholesterol in the periphery and bringing it back to the liver. This process is known as reverse cholesterol transport and is vital for homeostasis and balance of total serum cholesterol. Reverse cholesterol transport is a pathway for plaque reduction mediated by HDL. ApoA1 is produced from the liver and intestinal cells, released in the plasma for circulation. This apolipoprotein conjugates for 70% of the nascent HDL, which picks up the excess cholesterol from the peripheral and macrophage cells. This is then transported to the liver via the direct or indirect pathway. Direct pathway is facilitated through the SRB1 receptor, and indirect is via the LDL receptor. The precipitation test was used for the HDL count in a non-fasting condition, aka Greg's scenario. This test is a centrifugation process where precipitating reagents such as divalent cations and polyanions are used to remove all lipoproteins except for HDL. This process is facilitated by enzymatic cholesterol oxidase. Serum cholesterol is centrifuged for 18 hours and treated with heparin manganese. Dr. Boss,
Yeah, man.
this patient, Greg, he came in for a HDL count the other day and his numbers just seem all out of order.
I'll have a look.
There you go.
Yeah. Well, something does look wrong here. So, I think that you might have made some mistakes. So, let's have a seat, first of all. And tell me about what happened yesterday.
Well,
Never gonna give you up, never gonna let you down, never gonna run around and desert you, never gonna make you cry.
The precipitation method selectively assesses for HDL count. Greg's non-fasting result of 0.6 millimoles per liter of HDL places him well below the reference range of 1 to 1.3 millimoles per liter. This puts him at a risk of developing a chronic disease such as CVD. Non-fasting patients affect the HDL count compared to fasting patients. It was reported to have a maximum decrease by negative 0.1 millimoles per liter in response to normal food and fluid intake. In Greg's case, due to his high cholesterol diet, his error difference could be greater. Hence, Greg's actual HDL count would be greater than 0.6 millimoles per liter. Interference from elevated triglyceride levels due to Greg's non-fasting state resulted in incomplete sedimentation after Greg's sample was centrifuged. It is also observed that prolonged freezing at -20 or -70 degrees Celsius led to a shedding of ApoA1 from HDL and hence formation of poor protein particles. This deteriorates the HDL sample and hence is irreversibly disrupted. Studies indicated that HDL is a complex particle requiring special attention when stored. In general, of the precipitation methods, those using dextran sulfate tend to be more reproducible. Also, heparin manganese requires a 30-minute centrifugation under the refrigeration temperature. Another study showed that the addition of chiroprotectants, sucrose or glycerol, completely preserves structures and functions of HDL for up to 2 years. Therefore, adding chiroprotectants to isolate HDL samples before storage will make biochemical and clinical HDL count for effective analysis. If clinical decisions are to be made based on HDL count, determinations from 2 consecutive specimens taken at a 10-day interval were more accurate. The National Cholesterol Education Program recommended substantial improvement in analytical performances of the HDL count. Determination must be made. HDL-related conditions are reprimanded through lifestyle modifications, increasing physical activity, adopting a low-carb or ketogenic diet, and definitely, in Greg's case, quit smoking. But for now, to get a better understanding of Greg's HDL count, let's try a fasted blood test.
Well, that makes sense, Doctor. Thanks a lot.
No problem, man.
Right. Nice to see you again.
Hi,
Come on
Doc.
in. Come on in. Well, Greg, we got your test results back.
All right.
Yeah, well, not so much. Seems like you might be having to come in again for another blood test.
You gotta be joking me.
I'm not, but this time you must fast for 8 hours before you come in.
Oh no!
Authorised by the Australian Government, Canberra.